Today on Cancer Buzz, programs and practices to support caregivers. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. This episode is the second in our 4-part series on empowering caregivers. Our guest's cancer center has a Caregivers Clinic to support caregivers as they take care of someone they love. And what she says about support might surprise you. Allison Applebaum is a psychologist at Memorial Sloan Kettering Cancer Center in New York City.
Many caregivers come to me because they really actually want to talk about the possibility that their loved one's not going to survive. And they don't necessarily feel like they have permission to do so in the context either in medical appointments or at home with their loved one, but they're acknowledging that possibility. And so a lot of the work we do is focused on helping caregivers to bring that elephant into the room and to talk about death and to talk about what life might be like and to talk about how time can be maximized right now while their loved one is still here.
What are the challenges you see that caregivers face?
We talk a lot about sitting with uncertainty. So many caregivers struggle with the fact that they can't plan. They can't plan for the vacation in 6 months. They actually can't plan for the next day sometimes. And that is exhausting. And that's quite difficult over the long term for caregivers to continue to face such uncertainty. And then many caregivers share just incredible isolation that increases over time. For many, there's this feeling that there's so much support around patients, but so very little support for them, and they really feel left out.
How many caregivers participate in support groups?
Many caregivers do participate in support groups. We have at Sloan Kettering many support groups that are run by our Department of Social Work. Though many caregivers have come to the clinic and shared that sometimes support groups are not the best approach because, number one, caregivers are so distressed with their own challenges that sometimes hearing about other caregivers' challenges can actually be harmful and not helpful. And number two, oftentimes those support groups are not structured and there's not necessarily a specific topic that's addressed. And I would say that the big picture is that some support's better than no support. So caregivers being able to have a support group versus nothing is better. But overarchingly, caregivers have preferred being able to receive one-on-one support that's really targeted to their own unique specific needs.
Tell us more about the one-on-one sessions.
So the one-on-one sessions are through the Caregivers Clinic, where caregivers will be meeting with a licensed clinical psychologist or a clinical psychology trainee supervised by a clinical psychologist, as well as potentially with a psychiatrist or nurse practitioner if medications are required. So these are psychotherapy sessions where we implement many of the empirically supported interventions that I've discussed, such as cognitive behavioral therapy or meaning-centered psychotherapy. And we really try to tailor the sessions to caregivers' unique needs, which very much fluctuate from session to session and week to week.
How has the Caregiver Clinic helped caregivers address barriers to care?
One of the most overwhelming elements of being a caregiver is serving as a case manager for your loved one. And there are I don't know of any caregiver navigators within my own institution, for example, folks who can help caregivers navigate the system. And so inevitably, what we find often in the Caregivers Clinic is even though these are psychotherapy sessions, these are focusing on mental health, a lot of what we do is help with case management, helping caregivers to navigate the system that is MSK, providing guidance on resources available and departments to contact as needed.
Do you think other cancer centers could create a similar clinic?
Well, the Caregivers Clinic at MSK began in 2011. I think that over the past decade plus, there certainly has been an increase in psychosocial support for caregivers across the country. I also know that most cancer centers are very, very understaffed in terms of mental health professionals. But I do think the model of care that we have here is easily replicated. It began just with me. So really what one needs is one champion, one staff member, one faculty member who is passionate about supporting caregivers and can lead the effort. And I think that there's some concrete steps that could be taken to disseminate this model of care.
If you're interested in learning more about Memorial Sloan Kettering Cancer Center offerings, you can find links and resources in the show notes. If you're enjoying this content, we hope you take a moment to follow this channel right here on your favorite podcast player so you'll be notified when the next episode in our caregiving series is published. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.